Bainer. Here's a question. Were Americans misled about the costs of Obamacare? The president has long pledged that his health care law would reduce premiums and raise benefits. Now the Obama administration is conceding that some people, yes, some people will have to pay more, potentially even a lot more, for health insurance coverage. Our White House correspondent Brianna Keeler has the details on what's going on. Brianna, explain the latest.
Wolf, these were some comments that were reportedly made by Health and Human Services Secretary Kathleen Sebelius yesterday in an off-camera meeting with some journalists. She said, according to her aide, she was trying to explain that for some people who have kind of skimpy insurance plans who will have to essentially trade up to get better coverage under Obamacare, that there may be more costs associated with that. But Republicans who have long held that Obamacare is an entitlement that will break the country's bank are trying to say that the Obama administration is admitting that Americans will pay more for their coverage.
It was one of President Obama's biggest promises about his signature health care reform law.
Premiums are going to be lower.
And if you already have health insurance, we will lower your premiums.
But now the president's Health and Human Services Secretary Kathleen Sebelius reportedly said that may not be the case for some Americans, those who currently have lower cost so-called catastrophic plans who will have to purchase more comprehensive policies under Obamacare. These folks will be moving into a really fully insured product for the first time, and so there may be a higher cost associated with getting into that market, she said, according to the Wall Street Journal. Now Republicans are pouncing. On Twitter, Speaker Boehner and Michelle Bachmann seized on the comment. So did Senator Orrin Hatch, using the hashtag Broken Promises. A new study by the Society of Actuaries, which number crunches insurance costs, estimates insurance companies will pay on average 32% more for claims on individual insurance plans because of Obamacare. Some states fare worse. The report says California will see a 62% increase by 2017, Wisconsin and Ohio an 80% increase. Those costs, the report says, will likely be passed on to consumers. But the Obama administration is criticizing the accuracy of the study, saying it ignores a number of elements of the law that are expected to bring down costs. The White House is also taking aim at the group that conducted the study.
Well, I think that you're citing a study that I believe was conducted by a health insurance company that's critical of the Affordable Care Act. So that part I'm not particularly surprised about.
The Society of Actuaries contracted with a subsidiary of United Health Group to crunch the numbers for the report, Wolf, but the society itself is nonpartisan, and it says it stands by the numbers and the analysis. I will say, Wolf, that I spoke with an independent health policy analyst who said he doesn't think that the report is biased in that way that it has been alleged by the White House, but he does think certainly that the administration has a point that some factors have been left out of the analysis.
This dispute is only just beginning. Brianna, thanks very much. The details on health care costs come from accounts of a briefing that the Health and Human Service Secretary Kathleen Sebelius held with reporters. Let's drill a bit deeper right now. Louise Rednofsky is joining us from the Wall Street Journal. She wrote the article entitled Sebelius, Some Could See Insurance Premiums Rise. Louise, thanks very much for coming in. Now, you were not at the briefing that Kathleen Sebelius gave. One of your colleagues from the Wall Street Journal was there, and that colleague recorded the briefing and then gave you the tape. Is that right?
That's the case, yes.
So you listened to this. What exactly did she say as far as premiums going up for a lot of Americans across the country?
Well, the important thing to emphasize is that she spoke about premiums going up for some Americans, and in particular, folks who have skimpy insurance plans right now and might get more generous coverage. Now, this might seem like a little bit of an obvious point, that if people are getting more, they might have to pay more for it. But it's not really been something the administration has focused on so far. And so that certainly created a lot of controversy. The other thing that she pointed out was that some people who currently have lower premiums, perhaps because of insurance market practices like younger men, might see their premiums increase, even as perhaps older people or women see their premiums decrease. But they are acknowledging that some people might see their premiums go up. There are certain other things that they say might help offset this, like subsidies from the federal government to pay the cost of premiums. But we are now looking, and really we're expecting to see rate filings in the next few weeks that could give us the answer one way or the other, as if premiums, at least for some people, are going to go up.
Because as a senator, later as a candidate, and then as president, the president said premiums generally would go down. Did he ever ever leave a loophole out there that for some people premiums were going to go up?
Well, the administration is putting a lot of confidence in the idea that competition, particularly through the new insurance exchanges, will help keep rates in check. And then again, they've pointed out that people might be paying less for their health care, particularly if they get subsidies towards the cost of their coverage. But the premiums issue is certainly one that people notice. They're paying a lot of attention to it because in the early days of the insurance exchanges, what people see, whether they feel like they're getting sticker struck, could have a really big impact on whether or not they buy. And of course, as you know, if not enough healthy people buy, premiums get higher for the sicker people.
Because then everybody has to pay more. But as you know, even though all of Obamacare has not gone into effect, only a small percentage of it has gone into effect, a lot more in 2014, 2015, in the years to come. Some people already say they're paying a significantly higher premium already. Is that the result of Obamacare?
Premiums have been going up for a long time for a wide range of factors, but certainly what a lot of the attention this week has been focused on is what will happen when the really big provisions that change the insurance market pretty fundamentally kick in next year. And those include outlawing, for example, some of the insurance market practices that the insurers say have kept premiums down for a while.
I just want to be precise. The audio tape of Kathleen Sebelius, when you heard it, she was speaking on the record. She wasn't speaking off the record or on background or anything like that. No. This was an on-the-record briefing. Hey, thanks very much, Larissa Rednowski of the Wall Street